Oh, I started talking and was on mute, so I apologize. How is everybody tonight? Okay, everybody looks a little, are we stressed? It's week 7. Yep. How's med surge going?
It's going.
We have a test tomorrow.
Okay. Gotcha. I'm sorry. Yeah, med surge is rough. I remember med surge, so I do remember. All right, so we'll get your quiz out of the way. Yeah, 15 minutes. And all right, so the password for your quiz is in the chat.
Recording in progress.
All right, so we will go over the quiz. Before I go over the quiz, anybody have any questions? No. Okay. So during which of the following activities is the nurse in community health acting as a partner in change? No. So we have, I'm just trying to make it bigger so I can read it. Administering vaccinations to preschoolers, analyzing community problems to determine the best interventions, establishing an elder care center for older adults living with family members who work, or teaching anger management skills to a group of teens in a halfway house. Which of the are we acting as a partner in change?
Is it the teenagers or something with the talking to them?
The anger management in teenagers.
Right.
So we look at the community as partner, right? It is based on the nursing process. It's based on theories. And it emphasizes the dynamic nature of the community systems. And so, right, we're looking at the system as a whole, and then it's broken down into subsystems, right? All right, number 2 is a community health nurse encourages members of the community to partner and assist in creating health programs. Which of the following best describes the rationale for this action? And this was a select all that apply. So we had partnering results in increased effectiveness. Having many partners results in increased publicity for the program. Participating in planning results in having a vested interest in the outcome, and then involving community partners ensures increased support by the residents.
Partnering results in increased effectiveness, and participating in planning results in having a vested interest in the outcome.
Very good. All right, number 3, also select all that apply. A nurse wants to determine whether health problems have been improved and interventions have been appropriate and successful over a period of time. Which of the following data should the nurse examine? So we want to know whether health problems have improved and the interventions have been appropriate and successful. So changes in staffing patterns in the health agency, demographic data, education and school statistics, environmental factors, and utilization of health services.
So I got this one partially right, Professor. I chose environmental factors and demographic, but it marked it wrong for the environmental factors. That's not part of it?
It is. I will look at that. It
Please.
marked it wrong.
Yes, it did. It told me that the correct answer was going to be the demographic data and the utilization of health service. But I'm like, we always talk about environmental factors that
Right.
plays a big part with these people.
All right. So number was that?
Number 3.
Number 3.
I had the same thing for that one, but I think mine was a little bit further down for the question number.
Okay.
That was number 3 for me.
All fixed. Okay, so number 4. A nurse is planning an educational program about cardiovascular disease. Which of the following would be the optimal time for the nurse to elicit feedback from program participants? At the beginning, at the midpoint, immediately, or throughout the program?
Throughout the program.
Throughout the program. Number 5 was select all that apply. Which of the following characteristics must a learner possess to successfully master psychomotor learning?
Opportunities to practice the skill,
Mhm.
sensory image of how to perform the skill,
Mhm.
and the necessary ability to perform the skill.
Right, because what is psychomotor?
Basically, their skills and how they perform and how they.
Right, it's the tactile, right?
Mhm.
Okay.
The feeling.
Number 6, which of the following is most closely correlated with poor health? Age and gender, low socioeconomic status, minority race status, or high-risk lifestyle behaviors?
Low socioeconomic status.
Yes, low socioeconomic status, right? That is inversely related to morbidity and mortality for just about every disease. Number 7, which of the following statements made by a caregiver of an older adult should alert the nurse to assess for evidence of elder abuse? So mom is always into something and can't seem to stay still. So I've been giving her half a Valium to get her to relax so I can get some rest. Mom wanted to stay at her home, but we were scared for her safety. So we moved some of her personal belonging or personal things into her home and brought her to live with us. She has not been having incontinence problems since we've been taking her to the toilet every 2 to 3 hours when she is awake, or we have to feed mom baby food now because she has trouble chewing and swallowing regular food. So which ones would be indicative of elder abuse?
Mom is always into something.
Right.
Okay.
So those of you who works in healthcare now,
Mhm.
what is that considered?
A restraint.
It's considered a
Yep.
restraint, right? Okay, good job. All right, number 8. Which of the following is the most probable cause of the increase in new emerging infectious diseases?
Activities or behavior of humans, including changes in the environment.
Very good. Activities or behaviors of humans, including changes in the environment, right? Number 9, a school nurse asks a class about the ways HIV can be transmitted. Which of the following comments by a student indicates a need for additional teaching?
That was
I wouldn't sit next to someone with HIV.
next to someone with HIV. Yeah.
Very good. And then number 10, a nurse was reading PPD tests 24 hours after another nurse had administered them. Which of the following findings would cause the nurse to interpret the test as positive? So
A-
go ahead.
A 10 mm of swelling and increase.
A 10 millimeters of swelling and increased firmness in a client recently released from a correctional facility, right?
Right.
Because who they're higher risk, right? So I want to go back to the HIV question. I know some of you are a lot younger than I am.
I'm
I
sorry.
remember when HIV, I remember the early 80s when
You
HIV
want to get into it? Okay.
reared its ugly head. And so there were, you couldn't hug anybody, you couldn't kiss anybody, you didn't want to hold anybody's hands. It was almost like COVID all over again, or before COVID, just because we didn't have a really good understanding of the disease and how it was transmitted. Didn't really know a whole lot about the disease at all. And so we've made great strides in knowledge about HIV and how it spread. Obviously, we still can't cure it, right? But we can control it a lot better than we could in the past. So good job on your quiz. Any other questions about the quiz? Okay, so I'm going to ask this question. Who read the chapters for this week?
I'm listening to your lecture, but I didn't read. Well,
Okay.
I'm doing both, but
Okay.
I'm not done, but I did start. So
I realized when I started the lecture, there was no way to make it under like a half an hour. I was like, I'm just going to keep talking and get to the best.
I mean,
So
along with the book, so it is helpful.
good. I'm glad because I worry about that too. I worry about trying because I put the PowerPoints up.
Yeah.
So I can follow the PowerPoints that will help me stay on task, as well as, following along in the book so that it makes it kind of go whenever them. I just went in the order of the chapters.
Yeah.
Um,
PowerPoint highlights what's important in the chapter, so it is nice.
yes. So the readings for this week, sorry, I have to get out of the quiz real quick. So the readings for this week were chapters 5, which was economics and healthcare delivery, chapter 27, which was violence and human abuse. And then chapter 11, infectious disease prevention and control. And then chapter 12 was communicable and infectious disease risks. And so I think probably chapter 5 was probably the more tedious one, especially when you're looking at, healthcare, how healthcare is funded here in the United States, just because there is so much that is involved in that, between the laws and the insurance companies, Medicare, Medicaid, and how we spend our money here in the United States. We do as a country spend most money on healthcare, which is surprising when you look at as compared to what other countries do. Even when you look at, and there's pros and cons for everything, right? There's pros and cons with our healthcare system here in the United States or in some, of the other countries that have, I guess, technically free healthcare, right? And there's pros and cons to that. And you can look at some of the, stories that people have had. Sometimes the wait times are harder. You can't get in to see providers. You can't get the necessary surgeries and procedures that you need done on a more timely basis. But then you look at our system here in the United States, and a lot of times it's very similar, right? Getting into healthcare providers, specialists, could also be, an issue here. And so we do, like the quiz, said that socioeconomic status is inversely related to morbidity and mortality in almost every disease. And so those Americans that have an income below the poverty level have a mortality rate that is higher than that of middle income America. And that is sad, right? And so we did have things like the Affordable Care Act, Obamacare, however you want to phrase it, right? That goal of that was to increase the availability of health insurance for everybody in the United States. And it did have a huge impact for a lot of people. But we do know that there are still plenty of people here in the United States that are either uninsured or underinsured. And those 2030 or the Healthy People 2030 goals were to increase the proportion of adults who get recommended evidence-based preventative care, increase the number of community organizations that provide prevention services, increase the use of telehealth to improve access to healthcare services, and reduce the proportion of people younger than 65 who were underinsured. Anybody use telehealth? Does anybody use telehealth? So yes, I know, like, especially with COVID, it kind of made it a big, kind of came out of the woodwork, right? A lot of people went to telehealth services for a lot of things, even, disease management. Um, it's really interesting that, think of everything that we can do via telehealth. Just like you and I, you guys and I were having a course. We can monitor disease states. We can, look at things, talk about things. We can see the safety issues in somebody's house just by, having them walk around. And so there's a lot of advantages. Think of some of your people that live out in more rural communities. What do you think an issue with with telehealth in a rural community is, though?
For Wi-Fi?
Poor Wi-Fi. And so, if they don't have, good Wi-Fi, then that could be an issue. I will tell you one of the and I don't know, only because I was, so used to just the cable network, right? You plug your cable into your TV box, right? And everything comes. When in Texas, they have your cable is run off of Wi-Fi. Does anybody have that? Where your cable is run off of Wi-Fi? Like, it's just kind of like using Wi-Fi on your computer. You'll be watching TV and the next thing you know, it just like, it's gone, and you're like having to try to reset stuff. But just depending on where they live, they may not even have internet services in some areas, depending on how rural they are. So that can be a challenge, but there is so much that can be done via telehealth. And so, then just, but it can, open up a lot of things too. Like when we talked about, the amount of Americans that are going to be hitting 65, by 2030 or, 85 and up. Just the strain on the healthcare system for that age group, incorporating some of these telehealth measures. Even looking at your elderly that can't drive a car anymore, right? They can't get out into the community. And so those are some things that we can, look towards in the future. And chapter 11 was infectious disease prevention and control. So this was that epidemiological pathway again, right? Your host, your environment, and your agent. And so really understanding the epidemiological triangle will help. So like your agents, the four main causes of agents are your bacteria, your fungi, your parasites, your viruses. The individual agent may be described by its ability to cause disease, and by the nature and the sensitivity of the disease. And that's where we have those infectivity, pathogenicity, your virulence, your toxicity, invasiveness, antigenicity. Those are those keywords that we use to characterize those infectious agents. Your hosts, the host can be a human or it can be an animal that can harbor an infectious agent. And there's a lot of different characteristics of the host, right, that influence the spread of disease. How resistant are we to whatever, the disease process is? What's our immune status? And how infectious is the host? Think of who's got kids again. Raise your hand if you have kids. All right. So what happened when you put your child in daycare for the first time? right? They just were sick, right? Like you can't even say they were just sick, right? At least for the first 6 to 9 months. Um, and that's just because while they're home with mom and dad and they're not really out in, you know, the world of other children, they're not really exposed to much except for what maybe, the parents or caregivers bring home. If they have older siblings, sometimes that can play a factor, but you put your kids in daycare and it's a whole different world of germs, right? Um, Immune status, we do have natural immunity, right, which is just our innate resistance to infections. And then, of course, we have our acquired and our passive immunity as well. So those of you that don't work so I'm just going to ask for the ones that work in healthcare, how many of you got sick the first year that you worked in healthcare? Sam, you were lucky you didn't get sick. You have a good immune system. Um, I felt like that whole first year that I was a nurse, I was sick all the time. Like if it was something new, and now I don't get sick. Like I very rarely get sick. I may get I get allergies really bad, but as far as like flu, I didn't get COVID until after COVID ended, like after the initial, the initial surge. I worked a COVID unit, never got COVID. It wasn't until everything started to die down and I actually left left out of clinical healthcare and went into education. That's when I got COVID. I was like, go figure. Um, but, and then of course your immune status, most people do get their immunizations. But we still do have some that are anti-vaxxers and don't want to get their immunizations. And they rely on that herd immunity. And right, that's the resistance of a group of people to an invasion and spread of an infectious agency. It's based on, the fact that most people probably already have their immunizations. And, that kind of protects them from getting those infectious, those diseases as well. When we look at the environment, that's the physical, the biologic, the social, the cultural factors that are external to the host. And those environmental factors can help to facilitate the transmission of whatever that infectious agent is to other susceptible hosts. So think of, when we looked at doing the environmental assessment, the standing waters, the air pollution, all of those things, right? How do we keep our water, clean and free of contamination, breeding mosquitoes. I'm bad for that because I have a pool in my backyard. I love my pool during the summer. But yes, try to keep it very well chlorinated so that we don't have any, mosquitoes and things that are back there. And then even food safety, right? Using, when you're cooking your foods, not using like the same utensils, the same cutting boards for vegetables and raw meats. So you're not mixing, contaminating your vegetables from your meats. And then the modes of transmission, right? How do they get from one place to the other? And so when there, did anybody look at the CDC website to see what the list of reportable diseases are? It's a pretty good long list. And so some things that you wouldn't even think are up there. CDC. So anthrax, obviously, botulism, cancers are reportable to the CDC. Your STIs are reportable, diphtheria, your foodborne diseases like salmonella, also your hepatitis B's, or all of your hepatitis infections, your HIV, blood levels, trying to just pull out some, mumps, malaria, measles, have influenza A, plague. I hope we never have plague. Trying to see what else. Tetanus, toxic shock syndrome, in addition to all what we would expect. Any waterborne disease outbreaks are also reportable to the CDC, right? So those epidemiologists can do their investigation to try to, figure out where the issues are, what can we do to prevent that from, prevent them from occurring again. Emergence factors, emerging infectious diseases, those are where the incidence has increased in the past several decades or has the potential to increase in the next or in the near future. And they can be either new or they could be, known infectious diseases. And so keeping an eye on those. What else about this? And then prevention and control. The goal of a prevention and control program is to reduce the prevalence of a disease so that it no longer presents a public health issue. In some cases, we can even eliminate or eradicate a disease. So polio at one point was completely eradicated in the United States because of the polio vaccine. So anytime now we have, if we have a case of polio, we want to, it's going to, be considered an endemic to us. And that's the purpose of, the vaccines, was to try to get rid of some of those diseases. When we look at your primary, your secondary, and your tertiary preventions related to infectious disease. So primary would be to prevent the occurrence of the disease. So that's like your immunizations, your safe handling of food, eliminating some of the water sources like for mosquitoes. Your secondary would be to prevent the spread of disease. So what are things that we can do to help prevent the spread of disease? And then tertiary is to reduce complications and disabilities through treatment and rehabilitation, right? So all of those wonderful things. What else? And so there's a lot of diseases that were listed in that chapter. So some of your vaccine preventable diseases like your measles, your mumps, your rubella, what else? Pertussis, even influenza. Who gets their flu shot every year? Yes. So flu shots. So flu shots are highly effective. Yes, they are usually based off of the strain from the previous season, only because the viruses mutate and change from season to season. But I've never gotten the flu. So after getting my flu shot, so I will continue and hold on to the belief that that is what is preventing me from getting the flu. Who had their COVID vaccines? Yeah, not everybody had COVID vaccines. No. So just out of curiosity, if you're willing to share, and you don't have to, if you don't want to share, what are some reasons for not getting the COVID vaccine?
Because I had been swabbing people and been around it and been exposed to it, that I didn't see the reason to, that my body would have already had the antibodies created. and I didn't get COVID the whole time. I might have not shown symptoms or anything, but never tested positive for it the whole
Okay.
time.
Okay.
Mine's because I'm lazy. I literally could just go get it. I just don't want to leave.
Okay.
My job
I like the
forced us to
honesty.
get it. But I was able to try and use because I wanted to get pregnant as a way, and then as a way to not get the vaccine, because at that time it had not been, we didn't know what the side effects would be, if there would be any. And then my job rescinded that, and I was forced to get it or I would lose my job.
Mhm.
I had been working in the ER for ever since COVID started, and then as soon as they had me get it, within a week I had COVID. So I was a little on the fence about that, but I got it to keep my job.
That was a struggle that a lot of people had when the COVID vaccine first came out. Was that you were forced to get it, or you would, like you said, you would lose your job. And so they did that for at first, because, I live in a bubble sometimes, I'm in healthcare. At first, I thought it was just healthcare providers that were forced to do it, but then I realized it wasn't just healthcare providers. It was pretty much everybody was forced into getting their COVID vaccines. Even one of the companies that I had worked for a while ago, they're all remote. They don't even have any interaction with people. And they were all also forced to get. And so I know that my prior manager ended up being let go because he didn't want to get the COVID vaccine. And so that is a struggle. We do have requirements, especially for kids that are going into school, right? That they need to have their vaccinations prior to entering school, unless there, of course, is a religious exemption or a medical reason why they can't get their vaccines. A lot in the United States, across most, and I say most, across most of our practicing religions here in the United States, there isn't one that actually forbids you for getting your vaccines. Now, there are, in certain cases, like some of your Jewish sects, SECT, they had they would deny or they would refuse the polio vaccine just because it was made from pigs. And so I actually would have parents bring in letters from their rabbis, because rabbis would be like, it's a vaccine, like you can get it, we understand. That gave them permission to get their vaccine. Now that is to, help them in their faith, right? So they don't feel like that they're doing something wrong. And so I asked the questions about vaccines because everybody does have their own, feelings about vaccinations. I will be honest, I was a little nervous about getting the COVID vaccine as well, just because we don't know, right? It's newer. It was pushed through the fast track protocol through the FDA. So we really don't know what long-term effects, right, of the vaccine are. And so, but I did it because I just weighed the pros and cons, and I did work the COVID unit. I didn't know if I was going to get COVID. And so I went ahead and just got it. And so, like I said, made it through COVID and really didn't even get COVID until I started teaching. And then it wasn't even a student that got me sick. It was another faculty member. So I was like, okay. So, so there's that. But a lot of what we do as nurses, whether it's public health, whether it's in the emergency room, whether it's in your med surg, ortho, wherever you're working, is education, right? that's a huge part of what we do as nurses. And so, you know, are encouraging to get vaccines is something that we do. If you do have somebody that, you know, refuses vaccines, best thing that you can do is provide education, provide resources. Anything you want to find, you can find on the internet, right? If you know, you believe the ground is blue and the sky is brown, you can probably Google that and you'll have somebody else that's going to feel the same way about it as you do, right? And so just redirecting them to appropriate resources and the right websites to go just to make sure that they are getting the appropriate education. So I'm not going to go into all of the diseases because there are a great deal of those on there. When we look at chapter 12 with your communicable and your infectious diseases, this was primarily your HIV, your STIs, your hepatitis, your tuberculosis. And so these we know have a pretty profound effect on patients that are infected with these disorders. And so Healthy People 2030, the goal is to reduce infections of HIV, HPV type prevented by the vaccine in young adults, reduce the rate of mother-to-child HIV transmission, and increase the proportion of adults who get recommended doses of the HPV vaccine. So you answered that question about HIV very well. HIV is spread through contaminated body fluids. So blood, primarily is one. We know that it can go through breast milk as well to the unborn child, semen, vaginal secretions. Whereas, like I said, back when HIV or first reared its ugly head, or we first really put a name to what it was a lot different back then. And we had a lot of people doing some crazy things out in the public with, you know, sticking needles in movie theater seats and underneath the handles of the grocery carts. And so a lot of things have changed, like I said, since we did that. We can control the disease a lot better. We cannot prevent it. So we have, you know, the PrEP, which is your pre-exposure. We have the combination antiretroviral therapy for patients that have HIV to decrease their viral load, which has been very effective. And then, of course, we do have post-exposure prophylaxis as well. Should anybody, you know, find themselves in a situation where we know that they have been exposed. There was something I wanted to say. I don't remember. STDs or STIs, those are going to continue to cause a lot of, you know, issues. The numbers of gonorrhea, herpes, HPV, chlamydia continue to rise. Chlamydia is still the most commonly reported infectious disease, and gonorrhea is the second. And so, you know, with chlamydia, a lot of times they don't have any symptoms. And so it may be a little bit harder for them to initially determine that they have an STI, whereas your gonorrhea, right? Men generally have more symptoms. Women, again, don't usually have symptoms. So what are some things that we can do? Think public health. What are some things that we can do to help prevent the spread? How about, let's not help prevent the spread. What can we do to help people not get an STI? That makes sense.
Education on like safe sex practices and screening.
Okay.
Yep.
Educational. Where do we start with that?
Schools.
Mm-hmm.
Where?
Health class.
High school, middle school, elementary school.
Elementary school before they start their periods, or once they start to go through puberty, and then you can get more in depth once they hit middle school.
Well,
Yeah.
I work at a high school and we cannot speak to kids about sex education. Nope. You cannot. Not in Alabama.
Really?
Mm-hmm.
Oh, y'all strict.
Oh yeah.
So, okay, so I'm gonna ask, you work in a high school, what's your teen pregnancy rate?
I've had about 3 pregnancies in the last 13 years.
That's not bad.
Mm-hmm.
What about your STI rate? Do you have any
They
information?
would never tell me that.
So I'm in a high school, but I'm here in Ohio. I don't have many teenage pregnancies, although I had a few who thought that they were pregnant. But with mine, I am able to refer them out. But if I refer them out, I have to have a signature of a parent. And 9 times out of 10, the children don't want the parents to know, so they speak with me in confidence. So I'm usually like a mediator between the two, the parent and the child. So I'll have mom come up to the school and we all sit down and talk. And it work out pretty decent that way.
My kids go to the social worker and she calls the parents.
That's interesting because, I mean, we all went to high school, right? We all had sex education in high school, I'm sure. I will probably say my sex education in high school is a little bit different than anybody else's because I went to a private Catholic high school, so probably a little bit different, but kids are having sex in elementary school now. Like, it's crazy, right? Girls are starting their cycles at an average of 9 now. They are developing faster, right? And so they need to be educated on what's going on with their bodies, for one, and what to do. Their kids that information, right? How many young girls do we know that, they start their period, they had no idea it was coming. They have no idea what's going on in their body.
We can talk about changing bodies and periods, just not about sexual stuff.
So,
like in health class, just not about
Gotcha.
sex.
Gotcha. Okay. So we know that education is the key. What about what else can we do?
Offer community education at the Department of Health.
Okay. Free condoms, free STD checks. So, HPV, right? Your human papillomavirus. Some certain strains can lead to cervical cancer, right? So that was what the big push for was with the HPV vaccine. Who carries HPV, the male or the female?
Isn't it both?
Both.
So male primarily carries, and so they offer the HPV vaccine to males as well. What about, so now, yeah, that's interesting. Alabama is a little bit, I wasn't expecting that. So, all right, so who talks to them about sex? Is it their parents? Is that who is?
Friends and the internet. The
I was
parents
about
don't
to
talk
say,
about stuff like that. No.
about to say in Florida they passed the Don't Say Gay bill, so they took sex ed out of high schools here.
Mm-hmm.
Okay. That's very interesting. Okay. So now I'm gonna have to do some research because I wanna, yeah, things are gonna change a little bit. Okay. All right. So All right, so education. Okay, so education. All right. Immunizations is another primary prevention, right? What about some of your like your HIV patients? What are some primary prevention things that we can do for our HIV patients?
If they have a blood transfusion, make sure, um, or it's more so education. I don't know where I was going with that. I'm sorry. You have to educate them that on what they can and cannot do, and because know someone that does have HIV, and the biggest thing was he continued that and emotional support because he focused on more of what he could not do now that he was determined. And then I said, in all reality, the only thing you can't do is donate blood.
Mm-hmm.
That was it.
Okay.
So a lot of it's psychosocial and education.
Okay. Well, safe sex practices too, again, for your HIV patients. What about your IV drug users? What are some primary preventive measures we can do?
Clean needles.
Clean needles. So there used to be places that will do needle exchange, right? You bring in your old needles, they'll give you clean new needles. A lot of places aren't doing that anymore. So what can we do?
They can wash them.
Okay, so we can educate them on how to sterilize their needles, right? If they're going to continue to use them. Is that encouraging their drug use? You can look at it both ways, right?
They're probably gonna do it anyways.
They're going to do it anyway. So why not teach them a safer way to do it, right? So what are some secondary preventive measures for somebody that's been diagnosed with a STD or STI? Secondary.
Um, to keep it from spreading, basically, the use of condoms.
Okay, to keep it from spreading. What else do we have to? So we know that STI is reportable to the CDC. Who else do we have to notify?
The partner.
Or partners, right? So the partner and the partners or partners, they have to be tested and treated as well. Okay. So has anybody ever, oh, what was that? It was it was a movie. Anyway, so like you have two partners, right? And they get together and one of them comes up with an STI. All right. So then how many people has this person been with? How many people have this person been with? Right. And you can get into a pretty good circle depending on, what their lifestyle is like. Some cases it's, plain, very cut and dry, is maybe two or, three or four people. In some cases, it could be, more widespread. So we do have to notify the partners. We also have to notify any contacts so that they can be tested and treated. What would be a secondary prevention for tuberculosis?
Well, that still be like screening. So we know that they have it, but we can screen them in, especially if they're not taking their medications, to see like what medicines we can give them or watching them take their meds or something.
So it would be the PPD would be a secondary for
Okay.
somebody with tuberculosis. So doing the PPD. Tertiary for somebody that has tuberculosis would be maintaining their therapy, right? Did we need to do the DOT therapy, which is that directly observed therapy? That's where they literally have to go to a clinic. They have to go to the clinic, they take their medicine, then they can go about their day. We use that for patients that we consider high risk for non-compliance. So have you guys covered tuberculosis and med surg already?
Yes.
Yes. All right. So we know that, or even from pharmacology, we know that therapy for tuberculosis is long term, right? 6 to 9, sometimes 12 to 18 months, depending on how well they respond to the antibiotics, if it is drug resistant strain, right? Those kinds of things. So we know it's going to be for a long period of time. We also know that the medications that we're going to give them for tuberculosis are heavy hitting on the liver. So they run the risk for liver damage. They can't drink. They can't even take most over the counters when they're taking their antituberculin drugs just because of the effects on the liver. And so, just like with us, right? You get put on an antibiotic for strep throat, for a sinus infection, right? And I'll be honest, most of us do really good for the first few days, right? You take your medications, however, whether it's once a day or twice a day, you do really good for the first couple days. And then what happens? You start to feel better, so then you forget to take your antibiotic. I've done it. I know, and I'm sure, you don't have, I'm sure other people have done it as well. And so it's kind of the same thing, right? You start to feel better, it just kind of slips your mind because you're not acutely ill anymore. And so the best way to prevent the spread of the disease, to prevent the development of those multi-drug resistant strains of tuberculosis, is to make sure that they're taking their medication. And that's what that DOD therapy is all about. And then, another tertiary would be for HIV. If you have caregivers taking care of patients that have HIV, right? What are some things that teaching them standard precautions? As nurses, we have a higher risk of getting hepatitis B than we do HIV. With how we're with what we work with and stuff. So but it's that's going to be preventing the spread of the disease. It also helps to increase knowledge, right? Decrease fear. Because somebody has a disease doesn't mean we have to be fearful of that person that has the disease, right? And then the last chapter was chapter 27, which was violence and human abuse. And so, this one's probably the worst one, especially when we think of everything that is going on within this, society now. Community violence is violence that occurs between strangers, friends, or acquaintances. It usually takes place outside outside of residential dwellings. Your intimate partner violence, that's your physical, sexual, or psychological harm, including stalking caused by a current or former partner or spouse. Sexual violence is sexual activity when consent is not obtained or given freely. And then suicide, in contrast, is self-directed violence. And so our Healthy People 2030 objectives for reducing violence: reduce the number of young adults who report 3 or more adverse child experiences, reduce intimate partner violence, and reduce gun carrying among adolescents. So reduce gun carrying among adolescents. Where do adolescents get their guns?
From the
Yeah.
home.
Or their friends.
Or their friends, right? And so whether it's, mom and dad have guns in the home, and they know about the guns, or their friends, maybe they're not in the best neighborhoods, and these are things that are, widely available to them. So, that kind of thing. And so reducing that risk is probably, that is going to be a little bit more difficult. How do we get guns off the streets?
Better background checks.
Okay. But adolescents are going to be, they can't buy guns.
Encourage if you're going to own a firearm, you need to go through a firearm course and then to continue to teach firearm safety and how to store guns in the home effectively
Okay,
so that the children don't have access to them.
okay.
These kids got guns and I got license and they still got more guns than me. So I don't know if we're gonna ever get them off the streets.
Yeah, so they keep trying to make the gun laws stricter, right? More stringent. But with adolescents, that's the thing, like you have to be, I don't know how old you have to be for like shotguns and rifles and those kinds of things, but like you have to be 21 to buy a handgun. And that's primarily what we're seeing, right, with the violence is handguns. So yeah, it was just a question. I don't know what we can do to, just like how do we get rid of all the drugs that are on the street too, right? It's kind of like, what do you do? Because we've tried cracking down and we've tried doing all of that stuff and nothing is working. So what is the true answer to get, that? What are some things that affect violence in our neighborhoods?
Poverty.
Economic stress.
Poverty, stress. What else?
The feeling for the community to protect themselves if they feel like the departments don't or cannot provide that protection for them.
Okay. All right. So yeah, or a lack of trust, right? In, the police and who other leaders within the community, right? That could lead to it. What about, when we look at lower socioeconomic areas, there's not a whole lot to do, right? That it's almost like boredom, right? Also increases the risk. Um, Communities that stick together generally do a lot better than communities that are more divided, right? They're more cohesive units, tend to look out for each other a little bit better. When we look at violence, homicides, guns are, I wish we can just get rid of firearms. That would save so much. I get people want to go hunting and all that other stuff and talking about, walking around in the street carrying a firearm. It's, that just, it just brings fear into people. And it doesn't give a comfortable feeling, right? It's almost like, I don't know how to explain it. But when we look, we're just going to move through. When we look at sexual violence, what are, sexual violence? It is not, it is a sense of control. And so we look at sexual violence, most people know their attackers, which, is even a little bit more scary. So what are some things that we can do to, help I would say help to prevent rape? And there's a lot of things that, are out there. Biggest thing is like no is no, right? Making sure, we teach young women, right? You don't go anywhere by yourself. You always have somebody with you, right? Those kind of things to protect themselves. What do we do? Who works in the ER? Somebody said, I don't remember, Amanda. Somebody, you have a rape victim that comes into the ER. What's the process?
For us, if they want it, we will make them like a not like a Zymo. So there'll be a do not acknowledge. So we will not tell them anybody's there. And then that person is given a code word to, if they choose to call a family member. If that family member can give the code word, then they are allowed to speak with the patient or go back if they're with them or not. We are not allowed to take anything off of that patient. We have to wait until the sane nurse arrives, and she goes through her entire collections process. Once that's finished, then we can do other care for that patient, but we have to wait for the sane nurse to come and collect evidence. And then that nurse or that patient has to call, we have to report it, but they have to call and choose to do basically like to press charges if they knew who it was and things like that. But for the most part, that place will go on lockdown and limited visitors for the patient because we don't know if they're going to come back, and also it's going to be a heightened emotional state for the family members if they decide to tell what's happened to them.
Right. There's a big push. I can't remember, it's one of our hospitals, so I forget, for all ER nurses to become SANE nurses. So that they're all trained. And a SANE nurse is a sexual assault nurse examiner. So they are the ones that when somebody is assaulted, like Amanda was saying, they're going to work directly with the victim, whether it's a male or a female. They will collect all the evidence, and, do everything that they can do. And then they will also, if they have to go testify, they can do all that as well. And then, they're also going to help them find resources that they are going to need, like mental health resources afterwards. They may need social work. What if they can't go home? They may need to go into a shelter or somewhere else, depending on what the situation is. And so those services can be provided through the SANE nurse, or not her necessarily, but at least providing the resources for them. Human trafficking is another thing that is another issue, especially here in the United States. I think I said it in the lecture, for me to renew my Texas nursing license. I had to take a course on human trafficking, just basic. A lot of what was in your textbook was in my course for human trafficking, just because Texas is, a high risk area for patient or for people to come in that are being trafficked. Most people that are a victim of human trafficking are going to have some sort of involvement with a healthcare personnel, whether it's because of an injury, an illness. They'll be seen through the emergency rooms in the clinics. And it's just kind of being, a little bit of a heightened awareness when you're dealing with certain situations that, kind of like the hairs on your back, the back of your neck, stand up kind of thing. And so you can always ask. One of the, I think was a big change for me, was, I remember this was a few years ago, I had to go to the emergency room to get stitches on my finger because I cut myself on some tile. And they were like, are you in a, do you feel safe at home? And I was like, it's just a piece of tile. I didn't correlate it in my head at the time when they were asking me these questions, like, do you feel safe at home? Do you feel threatened or any of this? And I'm like, I really thought that they were asking this because they cut my finger. I was a little taken aback at first. And then I realized only because I wasn't working in an urgent care setting. I was working I remember where I was working at the time, but I was like, okay, we don't ask these questions. But these are all things, you know, that we can ask. Depending on the situation, will you get an accurate answer or not? Not, but you can continue to push. If there's a child involved, then we do have to get law enforcement, child protective services. Even if it's an adult that is in danger, right? We need to get our resources mobilized so that we can protect them. When we look at family, we got 5 minutes. When we look at families of that are domestic violence, child abuse is probably, you know, right up there with the worst for me. And only because I used to work in pediatrics and I had seen it firsthand, and it's just something that will never, never sit well with me. But we know just domestic violence happens. It's not always male to female. It can be it can be female to male. It can be directed towards the child. Children that live in poverty are 5 times more likely to be abused and neglected than children with higher socioeconomic resources. And so if you add in that the child has a chronic illness or any kind of a developmental or mental disability, that increases their risk even more. Box 27-1 in your book, things we can look for, like, are the parents child? Do they have a support network? Do one or both parents have a history of child abuse? Because we know that a victim of abuse or somebody that grew up in an abusive home is more likely to become abusive as they get older, right? So what are some things that we can do to try to break that cycle? Do they have any issues with substance abuse? How do they communicate? Does the mother of the child, seem frightened of her partner? Does the child seem fearful of the parent? So these are some things that we can look at, because we do need to be able to recognize that, the child is being, abused, and make the necessary referrals for help. It's the same with your intimate partner violence. It's very hard for these women that are being abused to leave their abusers. They often will make excuses for the abuse that occurs. They also may feel that if they try to leave, that their significant other will harm, kill them, kill their children. And so, of course, as a parent, you don't want anything to happen to your children. So then in a lot of ways, they will stay because of their children. And then it just ends up to be a vicious cycle. So they do need a lot of assistance, a lot of affirmation, a lot of, what's the word I'm looking for? Just a lot of help, in order to get away, from those abusive, and it's going to be ongoing. It's not something that, I leave today. Obviously we don't want them going back into that lifestyle. Elder abuse is another one, that occurs. And so I think it's hard sometimes with the elderly. I've been working with the elderly for the last 25 years, especially when you're thinking of, their cognitive decline. You wonder, how much of what they're saying is 100% accurate versus not. And so, and you can look in the news, and this bugs me so much, for lack of a better word, the abuse that goes on in our long-term care facilities. There's a long-term care facility here in Virginia that 18 people were arrested. They have state and federal charges that were being brought against the administrator, the director of nursing, as well as the medical director. So the medical director wasn't part of the initial issue, but then as they did their investigation, they got, as they were investigating with the one case, more and more stuff came out. And so he ended up being arrested. But yes, 18 people, they literally, the video shows the police at the facility literally checking IDs and cars as people were coming in, and literally arresting them on the spot. So, yes, but that is the gist of those 4 chapters.